question from Mr. Pranav. He has two questions. The first one is, it's said that most people, especially after 50, blockages remain common and hence risky. How to detect it, prevent it, and the remedy for it?
Yeah. When you are young, coronary artery disease progresses very fast. As you grow older, the disease progression slows down. So it is very, very important that we do everything possible to slow it down further by, if the cholesterol is high, we can take cholesterol reducing medicines. Changing the diet, they will definitely help. Losing weight is extremely helpful to the, the slowing down the progression of the disease. Coronary artery disease is a progressive disease. Once it starts, it progresses. But we can do several things to slow down the progress.
So the next question from the same person is, most medical treatments, the tertiary ones, are very expensive for most people. How can we minimize the costs, and especially for the economically challenged people?
Yeah, I just want to give them a data on the cost of, let's say, heart surgery. I left England in 1989, and the first surgery I did in Calcutta paid 1.5 lakh rupees for a heart operation 32 or 33 years ago. Today in India, we are paying the same amount or a slightly more amount 32 years later. So when people say that, cost of healthcare is very, very high, no other country offers healthcare at the price what is offered in India. My advice or opinion on reducing the cost, we can reduce the cost further, but reducing the cost will only result in compromising on the quality. As I said, 30 years, we are actually brought down the cost of the price. No other service or a product what was 1.5 lakh 33 years ago is available to you at the same price or a slightly higher price, right? So it is very, very important that everyone must cover themselves with the health insurance. Now, health insurance again is expensive, and they may not offer the kind of service you want. That is because a tiny percentage of the Indian population is accessing healthcare. Like, why mobile communication in India is so cheap? Because everyone uses mobile communication. If everyone has a health insurance, first thing is the premium will go down, then the service they offer will improve, everything will change. So I'm not saying that healthcare cost will remain formidable. It will also come down as more and more people access healthcare. As more and more people, why cancer medicines are so expensive? Cancer medicines are expensive because very few people are taking cancer drugs. And it's like a vicious cycle. Because it is so expensive, not many people take it. And because not many people take it, the price won't come down. So essentially, only option we all have in the country is health insurance.
I agree, and the earliest you take, it's better, because after a certain age, health insurance is not covered.
Yes, yes.
Yeah. Moving on, we have a question from Mr. O.P. Khanna. He says he's a heart patient. He health checks twice a year. All parameters are okay except platelet count, which is shot up after COVID 2 years back. Yoga has not helped so far. Is there something else I can do?
I would strongly recommend Mr. Khanna to visit a hematologist. Only looking at the platelet count doesn't make sense. They have to look at the entire profile. any good, there are very good hematologists in Bangalore, and he can meet any one of them to understand why the platelet count is high. Yeah.
Thank you. There is a question by Mr. Vishwanath. He says he has no BP, no sugar, but he's obese. He's 60 years old and is asking for advice.
First thing is, I would like him to go for a preventive checkup. That's very important to know the current status. Then get a professional help, a dietitian to advise you about the diet, and get a good yoga instructor to teach you yoga, and go for a walk. If you walk for an hour every day, believe me, in about 4 to 6 months' time, you will lose significant amount of your weight and you will feel fit again.
Yeah. Thank you. There's another question which says whether 1 teaspoon of extra virgin olive oil on an empty stomach in the morning is good for heart and diabetes health.
1 spoon of
extra virgin olive oil.
olive oil. All oils are bad, nothing to choose, but oil should be taken 3 or 4 teaspoons per day. You can choose any oil. And what is good or bad keeps changing based on, I guess, their marketing budget or some other factor. Because when I was a young medical student, coconut oil was responsible for all the bad things happening to people living in India. Like it was considered virtually like a poison. And today, Americans are drinking coconut oil to prevent dementia. All of a sudden, coconut oil has become a darling. So this trend keeps changing. So best thing is to limit as much as possible. See, the nature wanted us to have oil. So nature gave the nuts in which oil is present, and you are supposed to eat the nuts. Nature wanted us to have sugar. So nature gave us all the fruits and the sugar cane and everything for us to eat and get the sugar. But the nature gave us lopsided brain, and we started squeezing all the nuts and the cashew nuts and everything, and started extracting the oil. And this is the penalty we pay. So essentially, we need to restrict the quantity of these foodstuff.
That was very interesting. Definitely nature provides and we misuse what nature provides for us. Yes. This is another question from Mr. Baba Telka. He says he is a patient of RBB right bundle block. And is there any remedy available?
Generally, these bundle branch blocks, if it doesn't reduce the heart rate, does not need any intervention, but he should consult an electrophysiologist and keep monitoring the ECG once a year. Once a year, he can get the ECG done. But anytime if he feels dizzy or if he loses consciousness anytime, he must see the doctor, because that may be a sign that the block in the coronary heart is increasing. I thought there are too many questions around the heart. Let me just show people what heart is and how it functions, so that they can have a visual understanding about how it works. This is how the heart. Let me improve the background. Okay, this is how the heart looks like. Your heart is as big as your left fist. This is my right fist, but you know the heart is as big as the left fist. And the heart, if you open it up, there are 2 main pumps here. This is the right ventricle. There is impure blood here. This is the left ventricle. There is pure blood here. Now, how the circulation happens, heart keeps pumping like this for whole day. about 70 times, 80 times per minute. All the body's impure blood comes from the upper body, it comes here. From the lower body, it comes from here. It comes to this chamber called right atrium. This is the cavity where there is impure blood. And from here, the impure blood will go to this chamber called right ventricle. And this is the pumping chamber. This is the reservoir, this is the pump. When it pumps like this, there is a valve here called pulmonary valve that opens, and the blood goes through this blue pipe. The impure blood goes through the blue pipe, and left lung is here. Lung is like a balloon here. Right lung is here. It gets purified. And the pure blood comes to this chamber here. This is called left atrium. Here there is pure blood. So there is a pure blood here, there is impure blood here. From here, the pure blood comes to this chamber called left ventricle through the valve. This is called mitral valve. And
so I think we lost your voice. We are not able to hear you.
Sorry, can you hear me now?
Yes, sir.
Okay. This is the left ventricle. There is pure blood here, and the heart pumps like this. This valve called aortic valve that opens, and the pure blood goes from this pipe called aorta. This goes to right side of the brain. This pipe goes to left side of the brain. This goes to left hand. And the pipe goes down to supply blood to kidney, liver, stomach, and the legs. This is how heart pumps. It has got two pumps. Right pump carrying impure blood, left pump carrying pure blood. Now, you always hear about the heart attack. Now, this heart muscle is supplied by this red pipe called coronary artery. There is one here. There is one artery here called right coronary artery, and there is one here called circumflex. There are three pipes supplying blood to the heart. When they develop blockages due to fat deposits, cholesterol deposit, blood supply goes down. And if it gets blocked suddenly, you have a sudden heart attack. So this area gets damaged. So every time you get heart attack, your pumping capacity goes down by about 20%, 25%. It's like a heart is a 4-cylinder car. After one attack, it becomes a 3-cylinder. Then it becomes like a 2-cylinder. So heart gets weaker. That's why we want to constantly prevent heart attack. That is about the heart attack. Now, when you say stenting, what we do is we pass a wire from the groin, take it here, and we open the blockage with a balloon and put a metal tube inside. That is called stenting. Or a bypass is we open the chest here. Now we open from here, small cut we make. From there we do the bypass. If the blockage is here, we take a graft from the chest wall. On the chest wall, there is a pipe called mammary artery. It's like a pen. So we bring it down here and stitch it. So the blood comes from the graft and supplies blood to the heart. Another operation you constantly hear is the valve replacement. If this valve is damaged, we remove it and replace it with a mechanical valve. Or most of the time we repair it. And when you hear a child is born with a hole in the heart, that is, this is a pure blood here, pure blood, impure blood. There is a wall here. In this wall, there is a hole that is called hole in the heart. So this is how the heart functions. Yeah. Thanks, Pavitra. Carry on.
Thank you, sir. That was very informative. Okay. Is smoking got any direct relationship with coronary artery disease? If all health parameters, including cardiac CT, is normal?
Including cardiac CT?
is normal?
Yeah. First question is smoking related to coronary artery disease?
Yes.
Yeah. The smoking, among all the bad things we do, the worst thing we do to your body is tobacco. Whether it is in the form of smoking or gudka or all the koni or whatever you call, tobacco is extremely harmful to you, or the damaging to your body. It can damage the heart, it can induce cancer, it can cause all kinds of problem. So there is no doubt about the evil effect of tobacco. Now, he was saying coronary CT angio is normal. That's a great news. We can almost take a bet that this person will not have a heart attack at least for another 10, 20 years time. Yeah. A person who has a normal CT angio, every time they get a chest discomfort or something happening here, they can rest assured that they will not develop a heart attack. The symptoms are due to something else.
Yeah. So the next question is high cholesterol and low triglycerides a risk for a heart attack?
Yeah. See the cholesterol, it's very interesting. About 5, 10, 20 years ago, cholesterol was really considered as something very dangerous for the heart. But of late, the understanding is gradually changing. Like in my experience, I can say that I can produce you 1,000 patients who have normal coronary arteries with grossly abnormal cholesterol level. At the same time, I can produce another 1,000 patients with the extremely diseased coronary arteries with normal cholesterol level. Okay, so we are stressing too much on the cholesterol level. If it is abnormal, yes, we need to first change the diet, reduce weight, do everything possible. If that doesn't work, you can take medicines, right? But do not lose your sleep over the cholesterol. If you're doing everything possible in altering your diet, taking medicines, in spite of that, it's not really changing, don't lose your sleep. If you're in doubt, get a CT angio. If the CT angio is normal, you may even stop the cholesterol medicine based on your cardiologist's advice.
Thank you, sir. Is taking aspirin long-term a good thing for blockages?
If you have blockages, there is no doubt you have to take the aspirin. But if you do not have blockages, you need to think twice. Because it's not that aspirin is 100% safe. Aspirin has its own side effects. It can cause bleeding in different parts of the body. So it's not a medicine which should be taken lightly. But if you have genuine blockages in the coronary arteries or the brain arteries, it is very important you take aspirin.
Can coronary artery disease be detected through a treadmill test?
You see, the biggest problem we face with the treadmill test is treadmill tests become positive when the blockages are extremely critical. But what is important is we need to detect coronary artery disease when the blockage is 5% or a 10%. Because if somebody already has 80% blockage, what can you do other than doing the, whatever the bypass or a stenting or whatever? So a large number of young people, I live in Electronic City.
Yeah.
We see large number of youngsters coming for a preventive checkup, undergoing treadmill test, who treadmill test is negative, but they are obese, they smoke, and treadmill test is negative. And we tell them that you have no problem with your heart. And they go back to Electronic City, tell all their friends, and, guys, I drink and smoke, my heart is perfectly all right. And they send a very bad signal. And some of them, in less than a year, had a massive heart attack. Now, you see, we keep talking about preventive checkup.
Right.
But when we keep talking about preventive checkup, there is always somebody who will tell you that my grandfather, he smoked all his life and did everything possible what he shouldn't do, but he lived to celebrate 100th birthday. Then why are you forcing us to change our lifestyle? The reason why we need to moderate our life, why do we need to take care of our health, is because approximately, it's not very scientifically calculated figure. Let me say that, say 25% of the people, they have a strong family history of heart disease. And some of the families, no male member celebrated the 50th birthday. These are the families where, irrespective of how hard you work, it is very difficult to prevent the coronary artery disease. They have a genetic predisposition. So this is one extreme group. Let me assume they are about 25%. There is another 25% of the people who can drink like fish, smoke like chimney, nothing ever happens to them. Only way they will die is you have to shoot them down. But 50% of the people are fence sitters. We don't know whether they are vulnerable, whether genetically they are vulnerable or genetically they are immune. We don't know.
Right.
No way of knowing. So this category of people, if they moderate their lifestyle, don't smoke, should control sugar, blood pressure, then even if they are vulnerable, that can be postponed to quite a large extent. So the best thing is to assume that we are the fence sitters and we do everything possible to take care of us. So never draw conclusions based on these extreme 25% of the groups. Yeah, they are a rarity.
So the next question is, I might not know all the terminology, so it might be misspelled, but I'll try my best. Asymptomatic PPLE with diabetes, hypertension, and high lipids on treatment, and well controlled with drugs, would you advise them to have an angiogram just because they are senior citizens?
I would never recommend any asymptomatic person to have a coronary angiogram, but I would strongly recommend them to go for a CT scan, CT angiogram, which takes only 2 seconds. It is available anywhere in multiple places on roadside in Bangalore. They can get it done anywhere, and they have to do it. Yeah.
Okay. Any permanent cure for diabetes in the offering?
Right now, no. But in the future, there will certainly be cure in terms of, various genetic modulation, genetic, the cell therapy and various things or whatever is happening. There will be something which will click. Right now, there is no cure for diabetes. But I can tell you that I have seen so many young people who come to the hospital with 300 blood sugar, and our doctors give them 2 choices. One is to go on medicines or lose weight, and they opt to go for losing weight. And believe me, in 3 months' time, 4 months' time, their blood sugar comes to normal level.
Right.
Yeah, it's amazing. It's remarkable how it responds.
The next question is, for a normal person, what should be the frequency of health checkups?
Normal person, routine checkup like blood sugar and other abdominal ultrasound and those things should be done once a year. If the CT angio is normal, it should be repeated after maybe 10 years. Once in 7 years or 10 years is fine. Yeah. But other tests should be done once a year.
Is it good to use smartwatches which show all vital parameters?
I recommend everyone to wear smartwatches. Everyone. The reason is we all think that we are very active. We walk, people think we walk 10,000 steps, 20,000 steps. But when you actually start calculating with a smartwatch, you realize that you're not as active what you think you are. You need gadgets to constantly tell you how active you are. And I, as a surgeon, I always thought that my pulse rate was high. And when I started wearing my smartwatch, I realized that my pulse rate is in 60s. It's not even in 70s. So we have a wrong notion about how fit we are, or how healthy we are and how healthy life we lead. You need these gadgets, and these gadgets are only going to get better. Like, it's a matter of time before smartwatches will constantly show you the blood sugar real time. Like today, you can put some diabetic patches, blood sugar patches, which will tell you what the blood sugar is when you're eating. For a person who's diabetic, whose blood sugar is very high, if the watch constantly, as you're eating, if it shows you that your sugar is going up to 170, 180, time for them to control and stop eating. So we need to see that all these are important, provided you have a desire to celebrate your 100th birthday the way you want, rather than sitting on a wheelchair or on a ventilator.
Right. Next question is, post-stunt, how often should a patient have checkups?
Generally, once a year is more than sufficient. Once a year, unless they are unstable with something else, high blood pressure or some other problem, but generally once a year is fine. Yeah. And I recommend everyone to have their medical records in their phone. Today, different types of applications are available. The reason why you need to have it in the phone, when you go to see the doctors and you give them this thick file of paper, first thing is you may miss out some paper when it comes back to you. More than that, it is impossible for doctors to scan those, see those documents in the 10 minutes they have with you. Whereas if you have a copy of all your medical records, you may go to the doctor, they may give you the reports in a paper. Just use your smartphone, take a photograph and save it. That is a great help, because believe me, doctors go by the trend. Doctors go by your past data to diagnose your current problem. We are not magicians. We only analyze the data and tell you what is going on. So it's a great help if you save all your medical records in your phone. Why I keep telling people to save their medical records in their phone is something with you all the time. Today, people forget their spouse, but they never forget the phone. So this is the best tool for people to have.
Yeah. So the next question is long-term usage of statins bad for health?
Statins in high doses have a lot of bad effects as well. It's not like it's something which has absolutely no side. Most drugs have some side effect. Statins have a known side effects, especially on the liver and few other organs, especially in high dose. That's the reason why I keep saying statin should be taken when you have proven that you have blockages. Even if you have 5–10% blockages, statin will definitely help, but it should be taken after the diagnosis, not because your father had a heart attack or a grandfather had a heart attack and I'm reaching 60. Let me take aspirin, do not self-medicate.
Is there any established treatment for atrial fibrillation?
There are large number of varieties of treatment available, including virtual cure, but the person has to see an electrophysiologist. They are different than the cardiologist. Electrophysiologists are like, let me explain. This is the heart, and all the hearts have a pacemaker here. It is called SA node. That is like a pacemaker which generates electricity, and the electricity goes inside the wire. There are a lot of wires inside, and it touches this heart muscle. Now, atrial fibrillation is an electrical disturbance of the heart. So there are cardiologists called electrophysiologists. They're essentially like electricians of the heart. They understand how the electricity system works. They have gadgets called electrophysiology system, wherein they can check where exactly the electricity problem is happening, and they intervene without surgery by freezing certain points and virtually cure quite a few of the complex rhythm problem or the electrical problem of the heart. But you should see the electrophysiologist, not cardiologist.
So the next question is a hole in the heart to be repaired immediately?
Hole in the heart should be repaired immediately.
Should it be or should it not be? Can you wait?
Yeah, no, that's a very interesting question. There are certain holes in the heart which has to be repaired when the kid is few days or a few months old. There are certain holes which has to be closed when the kid is about 1 year old. There are certain holes which should be closed when the kid is 5-year-old. So everything depends on what else is associated with the hole and what is the size of the hole. That decision should be taken by a pediatric cardiologist only, because they are the people who know. Because if the hole is slightly bigger and you wait for 3 years, 4 years, when you see the doctor finally, specialist, he will say that, look, you have missed the bus. This hole should have been closed when the kid is 6 months old. It is too late, lung pressure is very high, and nothing can be done. And this happens all the time in our practice, because parents think that, okay, child is born with a hole, it will get better as the child gets older, it will go away. But it doesn't go away. So that advice should come from a pediatric cardiologist.
Thank you, sir. The next question is, I'm a BP patient from 20 years on medication under control. What is my risk factor for heart disease?
Blood pressure, uncontrolled blood pressure can cause brain stroke. Uncontrolled blood pressure can cause heart failure, or it may cause major problem like rupture of the arteries. Uncontrolled blood pressure can cause kidney failure. So these are the known complication of uncontrolled blood pressure. This has to be controlled, And today there is no excuse to say that my blood pressure is not responding to any treatment. There are expert doctors who know how to manage it. And there are investigations to find out why the blood pressure is not getting controlled. And there are gadgets which is available everywhere for hardly 2,000, 3,000 rupees, by which you can check your blood pressure. So there is really no excuse for not being able to control the blood pressure. As I said earlier, my advice for anybody who's recently diagnosed with high pressure is to reduce weight, lifestyle modification, exercise. You tell yourself that in 6 months, I would like to manage my blood pressure without medicine. It may not happen, but you go in the direction, at least your requirement of the medicine will be less. If you're 40 and if you are diagnosed with high pressure, are you going to take those medicines for the next 60 years? So we need to really look at how do we manage our health problem without medicines, without doctors.
Right. And like you keep stressing, health is in our control. If we exercise, eat healthy, we can lead a much more better and productive life.
Yes.
The next question is, what is LV diastolic dysfunction?
Normally, the heart keeps pumping like this, and that is the strength of the heart. If the heart, instead of pumping like this, it only pumps like this, we say heart is weak. That is called systolic dysfunction. That is, systole is when the heart pumps, it is called systole. When the heart relaxes, it is called diastole. Now, diastole is heart fails to relax fully. It doesn't empty itself. When that happens, lung is not able to drain blood into the heart. Then the lung pressure goes up. Then you are always having breathing difficulty.
So is there something they can do about
Yes, yes. A cardiologist will be able to give you the medicine and try to control those symptoms. Yeah.
Is it possible to clean lungs of a chronic smoker who smokes 40 cigarettes a day?
It is difficult to, I'll tell you something. My son was visiting Japan about 2 years ago, and he was working in a heart hospital. And during the operation, we see the lungs directly when we just open the chest. Most people in Japan, they have a lung which is pink. And we see only kids in India with the pink lungs.
Right.
In India, most adults, even non-smokers, have a lung which has got multiple black dots. So it is the penalty we pay for polluting the air. But I'm just saying that how much it makes a difference in our life to breathe in a place where there is not much pollution. It is remarkable. Yeah. And your question was about reversing the damage caused by the lungs. I don't know of anything which can relapse, but by quitting cigarette, you can at least prevent the progression.
Right.
Yeah, you can prevent the progression. Yes.
I've done CT angio. My calcium score was 1550. I'm a male of 69 years. What does this mean?
His calcium score is high, so he should see a cardiologist, and they will do some other test. And if the test is when they are 69, high calcium score is fairly common. That doesn't mean they have a blockage and they should go for an angiogram, right? let the cardiologist decide. And most of the time, if they are asymptomatic, patient heart is fine, they may just put them on medicines and continue. But if they have symptoms or echo shows some other problem, they may advise for angiogram. In simple words, if you have a high calcium score at 69, doesn't mean you need to go for an angiogram uniformly. Yes.
What causes and how do you treat pulmonary arterial hypertension?
Okay. Pulmonary arterial hypertension is, this is the model of the heart. Heart pumps like this, as I said. From here, the blood goes to the whole body. This is, when you say hypertension, somebody has a high pressure. We are saying pressure here is high. Normally it is 120. If it goes up to 150, the pressure here is high. Here pressure is about 20-25 millimeters. If it exceeds 45, 50, we call it as a pulmonary hypertension. This is systemic hypertension. This is pulmonary hypertension. Now there are two reasons basically when the lung pressure is very high. I mean 2-3 reasons. One reason is primary pulmonary hypertension. That is, without any reason, the lung pressure goes up. It happens mainly in women, and incidence fortunately is very low, and it can progress. And there are a lot of medicines which are coming up now today in the market to control those blood pressure. But if it is not controlled, it can worsen, causing severe heart problem. The common reason for a high pressure in the lung is when the heart gets weak, lung pressure starts going up. That is secondary pulmonary hypertension. And other cause of a high lung pressure is when the blood clots get formed in the leg, and those clots go inside the heart and they block the arteries. It's called pulmonary embolism. And that can be cured by medicines most of the time. If it doesn't respond to medicine, we can do the operation.
Can anxiety cause heart problems?
Of course, anxiety, mental status are important factors. Generally, it causes heart attack on a patient with the existing blockages. If a patient doesn't have existing critical blockages, on a normal coronary artery, people developing blockage and then causing heart attack is not very common. Most of the time, somebody hears a bad news and they had a heart attack. Those are the people who already had a pre-existing disease.
If your serum calcium is 10.9, can you still continue with calcium supplements?
They should consult a endocrinologist. I do not want to give my advice on the calcium level. Yeah.
Is it possible that the current quality of food that is chemically produced with heavy doses of pesticides can also add to the cause of heart health?
I strongly feel that I don't have the evidence, or at least I haven't read much about it, but I'm sure all the artificial preservatives, fertilizers, everything what we take, they're all after all chemicals. And I don't think there is any chemical which doesn't have impact on the human body. I think they definitely have, yeah.
If one had angioplasty 12 years back, is it still necessary to have statins?
If the cholesterol level is high and not getting controlled, yes, especially if they had angioplasty. That means there is a foreign body, the stent inside. So they need to take cholesterol if the cholesterol level is high. Yeah.
This is about diet. Do you recommend to have only rice or only roti for dinner? Does it have any effect on BP or cholesterol?
Rice and?
Rotis.
For cholesterol.
No, is it recommended to only eat rice or roti for dinner? Does it affect our BP or cholesterol?
Yeah, the carbohydrates do not directly affect the first thing is, let me not complicate things. We Indians eat too much of carbohydrates and we eat less of protein. So my suggestion to everyone, we always ate rice, we always ate chapatis, and we should continue, but reduce the quantum and substitute with proteins, fruits, and we have to gradually change the ingredient, the constitution of the food what we eat. Just because we have eaten that kind of a food, we shouldn't continue, knowing fully well that too much of carbohydrate has a lot of bad effect on the body. Yeah, so I recommend everyone to reduce the carbohydrate in the diet.
What is cardiac neurosis? Is it a common condition?
Fortunately, it is not a common condition. People who have a exaggerated impression about how their heart is, in terms of constantly worried about the heart attack. Some people always walk around with a hand on the chest as if they are supporting the heart. They're constantly worried about the heart. This is called cardiac neurosis, but it's not that common. Yeah.
Is electric physiologist available in Hyderabad?
There are many good electrophysiologists in Hyderabad and they can consult them. Yes, very good electrophysiologists are there. Yes. Every city in India now has very good electrophysiologists.
There are varying interpretations of high blood pressure. Some say that 140 by 90 is okay currently. Some say it is high. What are the correct admissible parameters?
As we say, 120 by 80 is normal, right. But 140 for a person who is in his 70s is okay. But we have to control it with less than 140 is kind of an upper limit what you would allow the blood pressure to be. And you can't bring down the blood person who had a high pressure throughout his life. It's not required to really dose them up to such a high level because you want to prevent sudden fall in the blood pressure. So 140 is okay for an elderly person, but a young fit person, 140 is high. It has to come down. Yeah.
Does myeloneuropathy affect the heart?
I wouldn't be able to answer the question, no.
Okay. I think we're at the end of most of the questions. If anybody else has any question, please raise your hand.
They are calling me from the OT, Pavitra. So I don't mind waiting for another 2-3 minutes, no problem. Yeah.
Just, so meanwhile, just one question. If somebody has to want to think about organ donation, and is heart a part of organ donation, and how quickly do you have to do that?
Yes, heart is definitely a very important part. You can pledge your organ in case, God forbid, you meet with an accident or you suddenly die. And if you have pledged your organs, then obviously, of course, your family has to give the final consent, but that's your wish. Family may not come on the way. If you're brain dead, your heart is still beating, then your heart can be donated. Yes.
I think there's a last question. Is MVP a serious condition?
MVP. MVP is a fairly common condition, especially among women. And in that, the valve called mitral valve, which opens and closes like this. So when the heart pumps, it closes. And when the pressure builds up, it opens a little bit more here. one leaflet opens. Then the blood goes in that gap. So the valve starts leaking. Generally, it remains like that and doesn't require any intervention. But all the people with the MVP should be monitored. Once a year, they should get the echocardiogram done. And occasionally, it will progress. And if they have a severe leakage, then obviously they'll require a valve repair, not replacement. These valves, they are very good valve given by God that shouldn't be sacrificed, and it can be repaired.
Okay. I think that's the end of questions, and I have a lot of people thanking you for this session, sir. It was an excellent session, and the way you explained it with the model, I think none of us had an idea of how actually heart works, and seeing it in person with the model was very, very interesting. So thank you very much for it. We wouldn't like to keep you waiting from your OT and your patients. Again, thank you for taking the time out to come and talk to us on this session. Thank you for the audience for all the questions you have asked. We do have several other sessions lined up in the next coming weeks. Please join us in that. And if you have further questions for Dr. Devi Shetty or on health, please contact us and we'll try to get the answers for you. Thank you, everyone. Thank you so much, sir, once again. And an excellent session. And I think from everybody attending here, a very big thank you again.
My privilege. Thanks, Pavitra. Thank you.
Thank you.
Thanks.
Thank you, everyone, for attending the sessions. Like I said, we do have more sessions coming up. Please do attend. If you have not yet signed up with us, please do. And if you have further questions for Dr. Devi Shetty, please send us a message on Vayah Vikas. Contact us at vayahvikas.org and we will get those answered for you.